Hello, everyone. Welcome back to another episode of Testimony Thursdays. I'm your host, Dr. Jazz, physical therapist, and we are going to get right into the episode, y'all, because we have a lot to talk about because it is the National Association of Black Physical Therapists Advocacy Week. And this week, we will be talking about postpartum care, how we can better serve that community, and of course, highlighting the optimizing postpartum care Outcomes Act. So, y'all know how we do. We always start with a scripture, and I feel like this scripture perfectly explains our guest. So, this is from 1 Peter 4:11. Do you have the gift of speaking? Then speak as though God Himself were speaking through you. Do you have the gift of helping others? Do it with all the strength and energy that God supplies. Then everything you do will bring glory to God through Jesus Christ. All glory and power to Him forever and ever. Amen. And I want to start with that scripture because our guest, she is using all of her gifts, y'all, to make a huge impact. And I have the pleasure of being able to read her bio. So, inspired by her own recovery using wearable technology, Dr. Kat founded Operation MIST, Operation MIST, and developed the Mommy Monitor to remotely monitor women's vital signs for safer pregnancies and better health. Through more than a period parties, lady parts, power parties, and 365 vitals trainings, Dr. Kat and her team empower individuals with practical education about their bodies and teach them how to use health technology to make data informed, heart protective decisions throughout every stage of life. They also partner with hospitals, school systems, corporations, and nonprofit organizations to reduce maternal mortality and morbidity by equipping communities to recognize the leading causes of maternal death from home. Dr. Katherine Sylvester is a physical therapist, home birth mom, VBAC doula, preeclampsia survivor, clinical assistant professor for women's health, Georgia Women's Policy Institute fellow, and remote health monitor. She does not believe in assumptions, protocol driven care, or generalized interventions. Instead, she believes that people's health journeys are as unique as their fingerprints and should be treated accordingly. So, welcome, Dr. Kat. Thank you for being here and for all that you do. If you could say hello to the people, and then we'll jump into an icebreaker.
Hello, everyone, and hello to you, Dr. Jazz. Thank you for having
Thank
me.
you. Thank you. So, we have a couple true or false questions to highlight our advocacy week. So, I'm going to start with physical therapy is only necessary after you've given birth, not during pregnancy. True or false?
False.
False. I would agree. I would agree. Pain during pregnancy is something women just have to accept because it's a normal part of being pregnant. True or false?
False.
I agree with that one as well. I agree with that one as well. And then physical therapists can play a role in helping women prepare their bodies for labor and delivery. True or false?
True.
Uh, Dr. Cat is in the building. And that icebreaker. And thank you for that bio. And girl, you're doing some great things out in the world.
Thank
So if we could start with how you came up with your company and the birth of advocacy through that.
Yes. So I love that you asked that second part as well, because then it makes it easy to answer the first. Because I had to advocate for myself, and because I had a provider who advocated for me, it made it easy for me to see how I could do the same for other people. And so when I was pregnant, my blood pressure went up to 128 over 78. Sounds like a nice blood pressure if you don't know my norm, but my normal blood pressure is 100 over 60. So when my midwife noticed the increase, she immediately jumped to action and she investigated to see if I had preeclampsia. In the birth world, typically a provider will not investigate until your blood pressure gets to 140 over 90. So, had she waited for me to get there, it could have been a more traumatic outcome. But because she intervened early and detected the preeclampsia early, I was actually still able to birth at home. Now, flash forward to after delivery, and I'll skip I'll skip forward to what I think is the most important thing. It is that after delivery, my care was transferred over to someone else because my she asked me to rest, to just like go on bed rest, make sure that I was resting. And as PTs, we don't really support bed rest. We support modifying your movement so that you're still moving enough to not have a respiratory illness or get a blood clot or have muscle breakdown, right? But we're not big fans of bed rest. So I scaled back my activity a lot, but it still wasn't enough. So I ended up going to the emergency room. My blood pressure was through the roof. The new provider took over. He was still telling me, well, he was saying you need to walk at least 20 minutes a day, try to make sure that you're managing your blood pressure. But nobody was really giving me real instructions that were specific to me. And so the outcome was that I kept getting worse. So when I got a watch, so a PT sent me a watch and she was like, "Hey, we're using a watch to detect COVID. Do you mind wearing the smartwatch?" And I was like, "Sure." So I went for a 20-minute walk, and after 2 minutes, my heart rate was 160. Now, I didn't know that. I didn't feel it. I just felt my watch buzz, and it was telling me that my stress was high, but I didn't feel stressed. And so I went on to check the other metrics, and that's when I saw that my heart rate was elevated. And so, if you're a PT listening or you're a healthcare provider, you know if someone's walking for 2 minutes, your heart rate being 160 is not the expected number. And so I walked back home because normally people will say if you're out after you have a baby and you start bleeding more or you start cramping, that's the indication that you should go home. But what I thought about was in that moment, why is no one saying if your heart rate increases by this much or if your you know what I mean? Like having numbers to dictate, because sometimes we don't see those symptoms that they're talking about, but we could still be doing too much. So anyway, after those 2 minutes, walked my little self back home, and that was the beginning of my beautiful recovery. My provider who took over, he thought I'd be on blood pressure medication for the rest of my life. He told me my kidneys would never heal because my kidneys were so severely impacted by the high blood pressure. And he's like, I've seen people like you before, meaning black people like you before. He didn't think I had a primary care doctor. He thought I was already on high blood pressure medication. Yes, so all the assumptions were showing up to the way he treated me. And I realized that those assumptions, had he been my provider before I had the baby, he would have looked at that number and been like, wow, that's better than numbers I normally see in black people, and would have kept letting me just stay pregnant, wouldn't have had any intervention. But it was good. It was a good experience for me because I realized that without individualized care, we're going to keep seeing the problems in maternal health, in regular health that we typically see. But with that watch, every day from then on, I woke up, I looked at my stress, my heart rate, I checked my blood pressure, looked at my sleep quality, and then I made decisions about my day from there. And I thought if every woman had the opportunity to do this, we would be in a much better place, not just for pregnancy and postpartum, but for life. We could show up to every phase of life better and more informed. And so we sent 40 watches. There's another PT, her name is Dr. Jessica Thompson. And I purchased all the watches with a grant that Perry Brubaker sent over and had me apply for. And the 40 watches, we sent them all over the country. And we monitored women pre-pregnancy, during pregnancy, postpartum, and started to realize fully what could be done if women had a mirror. Their numbers are like a mirror. You go to the mirror, you see something on your face, no matter how much of a hurry you're in, you're getting that off your face before you move forward, right? Before you move forward with your day. Same thing with numbers. What we're finding is women wake up, they notice, wow, my blood pressure is a little elevated, my stress is high. I'm going to modify my day so I can get ahead of this problem as opposed to just ignoring it, right? Because you can only ignore it for so long before it causes a problem. So that's how Operation Mist was birthed, out of my own personal need for it.
That is a beautiful testimony. And I'm so glad that I got to hear that at the National Association of Black Physical Therapists Conference. Let me put that plug in there. So that's where I first met Dr. Cat. And I was like on my feet, like, what is going on right now? When she was explaining everything, she presented at the conference. This was 2 years ago. So not this previous one, but before that. And I was just like, whoa, like this is how we can really advocate for ourselves and advocate for our patients, our families, our mothers, all of the things. So, what I'm hearing is that when you do have an experience that you may not have liked or it could have caused you harm, you go out and you do something about it and it births something in you where you can say, you know what, this is how we're going to do it moving forward. But you have to be the one that takes the step. So, thank you so much, Dr. Catherine, for everything that you're involved with the NABPT and with our advocacy week. So I'm excited to just being able to learn how to advocate more. Um, I also you sent me your impact from what your I don't even want to call it a business. Like I feel like this is like a revolution. Like what you have created with Operation Miss. And what stood out for me in that email you sent me was that you got some of your patients to get a second opinion or even a third opinion on when it was recommended for them to do a DNC. And I was like, what? So can you talk about that, about the baby's heartbeat and that process?
Absolutely. So, with sometimes moms will go in and they get their ultrasounds done. And in two separate instances that I'll tell you about, they went in, the ultrasound was done, they were told that there was no baby, they couldn't find the baby. And it was recommended that they go ahead and have a DNC right then. But they called me crying, like, oh my gosh, they can't find my baby. They want to do this procedure. And I was like, I would get a second opinion. And the reason, so in one case, I was not monitoring the mom. She just reached out to me because that's what she was told. And she heard that I help support moms, right? And prior to talking to her, it had to be just a couple weeks before, a mom contacted me and the same exact thing happened. She went in, she thought that she actually had gone into the ER and she was like bleeding and she was telling them, I think I'm pregnant, and they like, oh, they checked and they were like, no, you're not pregnant. And something in her was like, no, I am. And she had to go to two more doctors, but they ended up detecting the baby. And she went on to carry, like she now, since I last talked to her, has gone on to have a healthy baby. But had she agreed to the surgery, she wouldn't have. And so what happened with one of our moms was and we were monitoring her, because we really like monitoring moms before they get pregnant so we can see their body change in the way that we expect it to change. And there are a lot of women who experience miscarriage and they don't have care after they find out they're pregnant. It's like, oh yeah, just come on in. They come in, they confirm the pregnancy, but then they're not seen again for several weeks. And so they need people kind of to support them between when they get that initial appointment and then when they have their follow up. And so with this particular mom, she was told that, they couldn't find the baby, couldn't find the heartbeat. And I was like, your pregnancy was just confirmed and nothing changed about her data in terms of like her stress going down. Typically, when someone has a baby, we expect that their resting heart rate will go down, that their stress levels will go down. Like that's a normal expectation. But over the course of pregnancy, the stress will stay elevated a little bit after you conceive. And so her data did not change as if she lost her baby. So we were like, you did, and from what we're seeing, right? Because we can't see the baby's heartbeat, but we can see how the mom's body responds to pregnancies. I was like, you need to get a second opinion. And she went and got a second opinion. And they were able to find her baby. And she literally just had her baby. So, yes, yes, yes. So otherwise, she would have aborted her baby unknowingly, right? But numbers, when I tell you, I always say data will drive down disparities every time. And so in the other cases, because we've had 9 cases where moms, when they went back home, nobody said anything to them. They're just at home waiting for their next appointment. Their stress levels decreased. It was a surprise to us because we typically will reach out. You can't tell exactly what happened, but let's say a mom's stress goes down and we call her and she's like, oh yeah, girl, my husband sent me on a vacation and I've literally been laying in the bed all day. That makes perfect sense why her stress would go down. But if she sticks with the same pattern, the same routine that she's been doing, and all of a sudden her stress goes down, that is a sign. And in those moms, when they went to their doctors and were like, hey, I feel like something is off, do you mind checking in with me? The doctors checked their progesterone levels, and their progesterone levels were so low that had they not had intervention, they could have lost the baby. And so on each of those occasions, though, the doctors looked into it. They were able to check. They gave them the progesterone just to support them for the first 6 weeks about a pregnancy, rechecked their progesterone, took them off of it, and they went on to carry full term. And so I think, especially in the ones who have had 6, 7 miscarriages, even one is too much, right? But statistically, we're seeing us miscarry. We need to make sure that there is more vigilance around it, right? So that we're not losing babies just because we don't see our doctors for 6 weeks or 12 weeks or however long it takes for them to get their next appointment after confirming their pregnancy. So we love being in that position where we can really help moms advocate for what they need, because in that case the doctor's not doing anything wrong. They just don't have an appointment for you yet, right? And so we're there to fill in that gap.
Oh, whoa. Yeah. No, what? Like that? And what did you say? Data drives down disparities. Now, that is a very powerful statement. And I remember once again going to the National Association of Black Physical Therapists conference. Um, I got to hear Dr. Rebecca speak as well. And she was just talking about like how it's important to document everything that like you're doing, what's going on. So posting on social media. And she said, she wasn't really big on social media. She didn't really use it, but just sharing these people's stories so then someone else can benefit from it, and that can drive down disparities. um so thank you so much for sharing that. And then my next question, I do want to know, how did your physical therapy training and education help you with your patients now and what you're doing with the mommy monitors? Because for me, I'm gonna share a short story. I actually got to get my girl on the podcast. Now I'm thinking about it. I'm gonna text her as soon as we're done. But a very close friend of mine, she back when I was in physical therapy school, I was finishing up this. I think I was on like my last semester, and she was pregnant, but then she unfortunately had a miscarriage, and she went to the doctor, and I believe they had to do like a DNC just to make sure like she was healthy after the miscarriage and everything. But she just kept saying she wasn't feeling well after, and she was like very fatigued, and I think she had more bleeding, and I believe she had like umbilical bruising. And I was like, hey, like I think you may be having an ectopic pregnancy. And she was like, no, like I'm not having that because I had a miscarriage. Like I went to the doctor, I don't think I'm having that. And I was like, okay, as long as they checked everything, this is just what I was taught in school. Like it sounds like those symptoms. And then she ended up going back to the ER, and they told her she had an ectopic pregnancy and she had to get one of her fallopian tubes removed. Now she has two beautiful kids. But just looking back, this was when I was finishing up school. This had to be like 2020, 2021. And I just thought about my physical therapy training and how, we are qualified healthcare providers to help women through, postpartum care and prenatal care and all of those things. So, how has your training helped you with that?
Yeah, I love that you asked that question, because when I first started getting into the maternal health space supporting moms, people were like, physical therapy and moms? They didn't even see how the two went together. And then to then go on and realize that I'm not even talking about the traditional way you think about a PT with a mom in terms of incontinence and, pain with intercourse and things like that. No, it is what we learned about physiology is enough to help us support a mom through birth. Now, you do through pregnancy, pre pregnancy, it is, we know how to optimize numbers, we know how to prescribe exercise, we know red flags if someone is hemorrhaging, if someone is having a wound dehiscence. We know that for the regular population. And so all we're doing is applying what we know to the pregnancy population. The gap that I think needs to be filled, and that's why I love when I tell you Dr. Rebecca Seagraves is, I admire her so much, and it's not just because she's brilliant um, and just brings together a lot of people, one band, one sound. I'm trying to make sure we are all moving in the direction of improving the way that moms are treated, the way that patients are treated. But it's also because she brings education, fills education gaps that I think traditional institutes, like learning teaching institutes, do not teach. And so I just love that about her. I love everything about her, but that's a big part of what I think makes what she does with enhanced recovery after delivery so special. But yeah, I think that's what it is recognizing that we already know how the body's supposed to work. I think the tricky part with pregnancy, because people will be like, I don't want to do anything wrong. I don't want, or it's expected that moms are going to be more tired. It is, but we can help quantify what that looks like. And then we can also help them modify what they're doing so that they're not more tired, right? You don't have to, just because you have 2 stories in your house, that doesn't mean you have to use them every day that you're pregnant. As a physical therapist, we can come in and assess and say, wow, every time you go up the steps, because we're the ones who know about the metabolic equivalent of tasks, and we know that it is a task to walk up the stairs, whether you're pregnant or not. But when you're pregnant, you notice that their numbers go up a lot higher than a person who's walking up a flight of stairs and is not pregnant. And so that's a good moment for us to say, look, check your blood pressure, and when you walk up the stairs, within 5 or 6 minutes, your blood pressure is still elevated. It's at about 150 over 95. We don't want that. So what can we do to reorganize your space so that you stay on one level most of the time? The other thing that we can do is figure out, well, the blood pressure does go up. It doesn't come down in 5 or 6 minutes like we would expect that it would. But how long does it take to come down? So that's great for her too, because what if she can't put everything on one level? She can rest for 10 minutes instead of the 5 or 6, and then she get up and go about her business. And so I feel like helping people modify their activities. Oh goodness, thinking about like pain. So you know how like people always say towards the end of pregnancy, everything's painful, or sleep quality is trash. We can help them get into good sleep positions. And that's just a FaceTime. Like, I think, here's the thing, or for us, it's a secure video chat. We have a system that we use where we can call people securely and see them. And so we just look and see. And sometimes it's they have too many pillows. They don't have enough pillows. And for us, of course, we're not just looking at pain. We're looking at sleep quality. So if they're waking up in the middle of the night and using the bathroom, or their husband is snoring, I mean, if you can't sleep through the night because someone's snoring and you don't want to leave, you could put in earphones. And that way, their snoring is not impacting you. And so just trying to really help people figure out, how can I optimize the things that are going to keep me healthy? How can I sleep better, move better, or move intentionally? Because it's not always about moving more. I feel like a big part of what I've done and we've done as an organization is help people scale back. So what you'll typically find is when people are like, they're at their what you think is their due date, or they're at 39 weeks and a doctor says, hey, I want to, we're going to start talking induction the next visit if your baby's not here yet. What mom instinctively does is she looks up, how can I induce my baby? A lot of what people see is walking, just like walk as much as you can. Well, if you were someone who walked 2,000 steps and walking as much as you can now looks like 18,000 steps, that is way too much. So as a PT, we would know if you're walking 2,000, let's try 2,500 tomorrow, right? See how your body responds to it. Then let's try something else in a week. We'll go up to 3,000. Try it, right? So it's like, or could we do a different movement? So instead of doing that walking, why don't we look up a different way to make movement better, to help your baby get better position? But people go into panic mode and don't check their vitals to see if their vitals support that, right? But as PTs, we know to check vitals. And we know to see, is someone actually responding well to this activity or not? And if they're not, then we can jump in and help. So I think it ends up feeling more like coaching, right? Because you're using what you know of physiology to guide behavior in a positive direction. But it's absolutely something that we can do. And then how you picked up on the ectopic pregnancy, it's the same thing. If someone has a hemorrhage, is hemorrhaging, there are clear signs that there is blood loss. And so we just want to make sure that that's looked into. Now, if someone's soaking more than a pad an hour, let's say, that's a sign of hemorrhage. or if their blood pressure tanks, that's a sign of hemorrhage. And so as PTs, we just know that. And we can help them advocate for it. And that's why I love having the numbers, because it's not just about blood pressure tanking. If you're doing an activity and your heart rate goes up too high and your blood pressure is tanking and you're bleeding, you have all the evidence that you need for someone to investigate. And that's what happened with one of our moms. She was in the hospital, and this is sad, right? Because a lot of times you think, oh, you're going to catch things when people are at home, and we do. Most of the time, people are at home; they are not in the hospital. But this mom was in the hospital, and she was like, "I'm just so exhausted." She was like, "But they told me it's normal to be exhausted after you have a C-section." I was like, "Not so exhausted that you can't get out of the bed. That's not normal, right?" And combine that with your stress being elevated, your heart rate being elevated, and your blood pressure being low, they need to recheck your hemoglobin. And so she fought. She fought until they rechecked it, because they kept saying there's no need to recheck it. We just checked it 6 hours ago. And so they were going to wait. They checked it at 6 at night. They were going to wait 12 hours to check it. But they checked it at midnight, and it was under 7. And she ended up having to have a transfusion. Yeah. In the hospital.
It's So what I'm hearing is that advocacy never stops. It doesn't matter if you're in the hospital. It doesn't matter if you're seeing a specialist, OBGYN, doctor, all that stuff. It's you have to pay attention to the data and you have to say, you know what? I'm not feeling right. Do it again. Retest me, re-examine me, and if you don't, this is another trick that I learned. If you don't re-examine me, put that in the medical record that I requested it and you didn't want to do it, and that's what you need to document. Um,
Absolutely. And you keep looking for someone else, so that, a lot of the stories that have come out, because majority of the time, to be honest with you, when I first started, because of my negative experience with my OB, I thought, or he wasn't my OB. I did not choose him. He was the one who was supervising OB for the midwife that I chose. But when he made the comments that he made and offered no support, I was like, wow, this is how people go without care for their whole lives. Can you imagine if I was just like, yeah, I'm going to be on this blood pressure medication forever? That's what he told me is going to happen. And I just went with it. I would have, but when I tell you, I didn't need anybody else's opinion. You talk about, I love this being a testimony Thursday. I know who I serve. I know who created this body. I know that he can heal me. So in 2 weeks after this watch, girl, please, I was resting so much you would have thought I wrote the book on bed rest, okay? I was like, can y'all get that for me? Okay, I'm going to go to the bathroom, back to the bed. I'm going to use my data to make really good decisions and let the body that I was given, that was divinely designed, that has so much built-in redundancy. I'm a neuro girl at heart, and I just think about how when one thing isn't working, God is like, that's okay, there's another part of the body that can help you with that for now, while you stimulate your body in a way that is going to be supportive of where you are, while you rest your body so that it can, whatever the part that it is that's injured, can heal. Like, I knew that. So, girl, 2 weeks, I was off the medication. 9 months, my kidneys had completely healed. And I was like, yeah, I'm not trusting your report. And I'm getting a pharmacist. My best friend, I have 3 very close friends. One of them is a pharmacist, and the other one is a medical doctor. But she just practices like family medicine. And I reached out to them. They helped me with my meds, helped me. I realized, I got a dietitian on board, had people praying for me all over the country. I was like, we are getting through this. And if he's not referring me to anybody, I will self-refer. And that's what I like people to understand. You can self-refer. You don't have to wait for someone to say, look, this is where you need to go. But what I also did as a therapist who had access to see a lot of notes while I was in the hospital, I had already chosen my medical team before I needed them. Have you ever heard the saying, they say, be known before you're needed? I think in reverse, that's what I was doing. I got to know my providers before I needed them. I chose, and still have chosen, a cardiologist, a kidney doctor, an endocrinologist, all the providers that you can see in the hospital. It was like based on how they treat their patients. If I ever needed anything, that's who I would go to. And so when I tell you, I called the kidney doctor that I knew because his brother worked in the hospital. And I was like, hey, this is what's going on. Can I come see? What do I need to do? He said, you don't have to worry about doing anything. You come in, I'll get the referral from your doctor. I'll get everything that you need. And that's how I got my kidney doctor. It was like I wasn't going to wait on the guy who said my kidneys were never going to heal. If something's wrong with my kidneys, wouldn't you think he would have referred me to a kidney doctor? But he didn't. And so we have to really take matters into our own hands. So while I ran into the worst of providers, I also ran into the absolute best of providers. And so I know both are out there. And so what I try to do with our moms is get them to choose the best provider ahead of time. Don't wait until you get pregnant to choose your midwife. And I say midwife intentionally. A lot of people are choosing an OBGYN. OBGYNs are trained surgeons. And so if you are choosing a trained surgeon, when you run into a problem, they will do surgery. If you have a midwife and she notices that you pivot from what is expected textbook wise, something is quote unquote going wrong, she supports your physiology where it is and sees if she can still support a physiologic birth. Of course, it is not always responsible to go through and have a physiologic birth if your body can't support it. But if it can, then why would you not? And that's a big part of what we do too. If moms are told, hey, you need to induce, we look at, I mean, if they're fine and baby is fine, then we just encourage them to ask for a concrete reason that an induction is needed. And that is why we have had so many avoided inductions. And it's important to note that because if you have an induction and let's say you're 39 weeks, there was this study that came out that was talking about how, you know, outcomes are just as good if you get induced at 39 weeks as if you go into labor spontaneously. And there was a lot of question, not a lot, let's just say, because we all know research, they were looking at women who were, let's say, younger, first time moms, baby was positioned head down, like they were in perfect position to quote unquote be induced. But when you take that same study and then say, okay, well, we're also going to induce a mom who this is her 5th pregnancy, baby is not in the proper position, she has pre-existing comorbidities, you can't use that research and then just induce everybody at 39 weeks, right? But the other thing is due dates are not always right. So what if that 39-week baby comes out and it was actually 37 weeks? And so now baby's in the NICU because they weren't ready to come out. And so I believe, and this is just my personal belief, and people who come onto MIST, they typically believe this too. Our bodies were uniquely and specifically designed to create, sustain, nurture, and bring forth life. And so if that's the case, if that is true, then why are we intervening, especially in a process that we hadn't even figured out all the way yet? When you look at it, right, people don't know why, how things are happening. There are still questions. And it's like, but you're still okay intervening majority of the time. But because I've seen it go left more with intervention than I've seen it go right, I really encourage people to not have interventions if they don't have to. And so that's what I love about MIST. That's what I love about monitoring. It is that people can objectively say, my body is doing great at 39 weeks. My baby is doing great at 39 weeks. The doctors do a great job of deciding, is the baby doing great, right? Because they're checking in on them all the time. A lot of times moms are not checking in on themselves. They're going based on how they feel. You feel more tired. Great. Let's help you feel more rested, right? Like there was a nurse, I'm just in love with her. And she came on our podcast. She also had a baby with us, but she's an L&D nurse. And she said, you know, moms have to realize that instead of trying to figure out at 39 weeks, how do I get this baby to come? How do I get this baby to come? It's like, how do I get more comfortable so I'm not sick of being pregnant? If you focus on getting more comfortable, and who does that better than us, right? We help people get comfortable in uncomfortable situations every day of the week. That is what we do, right? So if we can help them get more comfortable, they'll stop focusing on making this baby come. If we can make sure that they have support for whenever the baby comes, not my mom flew in today because my due date is today, and so now she can only stay for another week. Now there is that built-in pressure. So can we get mom a plane ticket so she can go back if she needs to? Or can we get her to extend her leave so she can stay until your baby gets here? We have got to stop intervening on processes just because we can. Let's do it when it's necessary, right? Like, I think that has been the secret sauce with Miss. I promise you. But when I left the hospital, Dr. Jazz, when I tell you I was on those steps crying, I loved my job. I loved working at the hospital. I love seeing what people call miracles, because I work with people with brain injury, spinal cord injury, stroke. That was my whole life, right? And it was like people would say to these patients, you'll never walk, you'll never see your child, graduate from kindergarten, you'll never, never. And girl, it's like with enough time and with enough intentional work, they did it every time. So I was used to seeing what people thought were miracles happening every day. And so when I left the hospital, I cried because I felt like I would be missing out on seeing miracles. So in my mind, I was like, I'm just going to still see patients who have neurological injuries so I can be reminded of how incredible God is. And God, on those steps, I promise you, he said, if you buy my women time, what you think is a miracle is child's play to me, and I'll show you. I will show you what I can do if you give me a stage. Have you ever heard that song? It says, oh man, it's so good. It says, I'll give you, I don't mind if you steal the show. Have you heard that song? I don't mind if you steal the show. It's such a good song. I can't really sing. But when I first heard it, I was like, that's how I feel. I'm going to move out the way. We give God a stage. We give him an audience. And he will show out every time. And that's why we've had moms give birth to their babies at 43 weeks. We've had people who they were told at 16 weeks because their water broke that their baby wasn't going to make it. Baby went on. I'm talking about they took the baby to the NICU because they were scared. The baby came out so healthy that they were like, we're just going to take it there just in case for when something goes wrong. And it's like nothing went wrong. We've seen people who were told, because they didn't get pregnant for nine years. You're never going to be able to get pregnant without IVF. And yet they come on and we show them, you're stressed. Your job is stressful. Why don't we back off the job? Why don't we get a different job? Why don't we work remotely? I don't know what it is about your job, but this is causing you a lot of stress. And you're stressing while you're supposed to be releasing an egg. And that's not good, because why would the body bring forth life in a stressful situation? And yet they take a month off of work and now they're pregnant. Like, God is like, give me time. And that's what I think data does too. It gives women time. We literally had a mom, she's coming on, she can't wait to do her testimony. She was told at 36 weeks to have her baby. They were like, the baby's head is small. So like they used to, and I know that there are things that are true indicators that something is wrong, right? So I'm not saying, or the stomach was small, that's what it was. So I'm not saying that these are not real indicators. But the baby's 36 weeks, and if we're off, could be 34 weeks. So her question was, can I just wait? Can I just see what happens at 37 weeks, right? So they were like, sure, for that first week. So then we were like, well, I mean, you're still looking good. Baby's still looking good. Baby's still like testing well. Nothing is quote unquote wrong with the baby. It's just that their stomach is measuring. So 38 weeks comes, and she asked for another week. 39 weeks comes, she asked for another week. And they were like, at 39 weeks, they were like, if you do this again at 40, we're not delivering your baby. So now she's in a position where, I don't know if you know this, but like it's hard to find a provider who will take you at 40 weeks, because here it's hard to find one after 24 weeks. And so at 40, you're really gambling, right? So she's in this situation, and we were like, no, there's a spot in Atlanta that will take you anytime. So if they truly cut off your care, you still have somewhere to go. You should not lose choice just because a doctor is uncomfortable. Now, here's how I do feel. If a doctor is uncomfortable, they've never been in that situation, I would rather them say, look, we've never done this before, but we can find somebody for you who has. And I've seen that happen. And when I tell you the last time that happened, oh my God, the doctor actually came to the birth. The one who swapped, they were like, look, we've never supported this, but we want to support your decision. We know a doctor in Macon who has done this before. They sent the mom and her baby to that doctor. That doctor contacted the other one, and they came down to see the birth. And they said, next time someone asks me, have you ever seen this happen in the 20 years, 30 years that you've practiced, I'll be able to say yes. So thank you for this. Girl, I'm like, God just, when I tell you he moves, so with this mom, she went on to a different practice who was willing to support her birth, and it was almost 43 weeks before she delivered her baby. Baby healthy, just fine. Mom was healthy, just fine. And it's like when you have numbers that are saying mom is fine, baby's fine, then what's the excuse for the induction? I don't know. But what I do know is a baby that was designed to come, appointed to come at almost 43 weeks, would not have done well if they came at 36. And so for people listen, because I feel like even as providers, sometimes we start to say, well, man, if everybody else, like the baby's not here, everybody's worried, maybe I should be worried too. Maybe the people who have done this need to record their stories. Like Dr. Seagrave said, like you just said, like what you're doing right now, so that people know, oh, maybe the provider's uncomfortable. Could they help me find somebody else? Or if they do make the decision, it was their own informed decision. They knew what was possible. And then they went on to make their own decision, but it should be our choice, right? As long as everybody's healthy and everything's fine. And so we see people make more choices that are in alignment with their baby's divinely appointed time to come than people who are saying, oh, I'll just induce because someone's asking me to.
Girl, what's the name of the sermon? What's the name of this sermon? And I was just talking about this. I was literally just talking about this. I was
Yeah.
like, I love being a physical therapist because I get to witness miracles every day. Like this is something I was just talking about like a long time, not a long time ago, I guess like 2 years ago, one of my spiritual mentors asked me, like, why do I believe in God? Why do I believe in Jesus? And for me, it's through testimonies. So that's why I love this platform that God has given me because I'm like, I get to constantly hear it like, oh my goodness, like this is nothing but the Lord.
Yeah.
And like how you said, when you give him that stage, when you give him that platform, when you speak about it, like he's getting all the glory. He's the one that's like, we can't do this as humans. We cannot do this. Like I read this post that said, you can't even parallel park, and you think better than the Lord.
Listen.
So it's like, oh my gosh, we have to be obedient. We have to take inventory. And that's how you helped me, like even with my blood pressure. When you came to that conference, you were on fire. You was like, why y'all don't know y'all vitals? Y'all should be knowing after you pee, take your BP. That's what you said. You were like, you should know your normal. You shouldn't wait to go to the doctor and the doctor tell you your blood pressure 120 over 99. It's like, what? You should know these things so you can be able to do it. You should know your temperature. You told us your daughter, I think at the time your daughter was maybe like 6. You were like, my daughter wakes up and takes her vitals. Like, y'all should be able to take y'all vitals. Y'all are physical therapists. And I'm like, I need to get it together. And my diastolic number was elevated. It was like 99. And I was like, oh, I have to get it together. I need to make lifestyle changes. I need to exercise more. And now I'm a cool like 113 over like 75, like, and that's
Yes.
for my family. No shade to my family, love y'all. But we have high blood pressure. And I'm like, for it, you almost think like how you said your normal was like 100 over like 60. You kind of think like, oh my gosh, like what's wrong with that? Or if I went to the doctor and if it was 125 over 85, I'm like, oh, fine. But no, that's not my normal anymore. So it's like, oh, wait a minute. Am I stressed? What have I been eating? Like taking inventory of everything that we're doing, even from a spiritual standpoint. It's like, sometimes when I'm feeling a little cranky or, I do something or I say something I'm not supposed to do, I'm like, whoa, did I get my time up with the Lord? Am I being obedient? Am I being surrendered? So just being able to ask ourselves those questions and taking that data down and being serious about it. So thank you. And I listened to your podcast as well. I think I remember that story you're talking about, or it might be with a different lady. But this one who I listened to, both of her fallopian tubes were blocked.
Yep.
Ended up having a baby, and even in the podcast, she was like, "Hold on, girl, I gotta go get my baby real quick," because I think they were waking up from a nap or something. And I was like, "What? Both of your fallopian tubes are blocked, and you still have a baby?" So
Girl, we serve a God. When I think about one of my favorite verses, and this is really, I think it's He makes streams in the desert, or He makes ways in the wilderness and streams in a desert. I'm like, when you know who you serve, I mean, because even when my midwife was like, we may have to birth at the hospital because of of the preeclampsia, I was like, wait. Wait. Listen, the one time, because she's never seen me cry, even after I birthed my children, not from not sad tears. But when she said I might have to birth at the hospital, I cried. I did not. I know that in the hospital, the one thing that is lacking is faith. And I knew I needed to be surrounded by people who were faith filled. And so for me, I had to explain to her that will drive my blood pressure up. So even if everything is cool with my blood pressure, if you change my environment, it won't be. And she was like, let's just, I had never worn a monitor before. So, they talk about how wearing the monitor has been one of the major reasons that unnecessary cesareans have been performed. Because when they started using the monitor, it's like everything that they saw that looked like it could be wrong, they just went ahead and would intervene. And even though research shows that it's not as reliable as they think, the most reliable thing is actually putting a heart rate monitor on the baby's head, if it's possible, so that they can see, is this actually the baby's heart rate, or is the monitor picking up on mom's physiology? So mom may be anxious, or something might be happening with mom, right? And it's showing up in the baby's data. And so then they're making these decisions, even though research, I'm going to send you a video. It's just 3 minutes long, and it goes to the research that explains why continuous fetal monitoring might not be the best thing. You just monitor intermittently and just, spot check, just like we do blood pressure, right? Very rarely do they have you walk around all day with a blood pressure monitor on. Sometimes when they do, it's great because we know blood pressure fluctuates throughout the day. It's going to go up if we exercise. It'll go up after we eat a salty meal, but it's expected to come back down. So they're looking for that. It's low risk when you're wearing it typically, right? But with a baby, you don't want to guess and be wrong, and I understand that, but when you're looking at numbers constantly, what they're finding is resulting in higher C-section rates. But why did I tell you this? So she put the monitor on me to see, okay, if baby checks out 10 out of 10 and your blood pressure is still in a manageable range, then we can still try to have the baby at home. And that's how we still had it at home. She literally had a blood pressure cuff on me. It was on my wrist. I pointed to my wrist. I do not support wrist monitors, but she had it where it was close to my heart, whatever, and she would check it every 30 minutes like clockwork, and as long as it was fine, we stayed home, and my baby was here in 5 hours. And so it's like, I know, right? I just feel like she didn't take my options away. She let me know what was possible, and we made the decisions together. And I think that when that happens, there are no regrets, right? Because if you look at the statistics, and the National Institute of Health, I think, they shifted their numbers, but years ago they said 8% of C-sections are actually necessary. That means if you don't do it, mom will die, baby will die, something bad could happen, right? And yet you look at our country and the C-section rate is 33%. And so fast forward a couple years, NIH, or I think it was NIH, don't get me wrong, or let me misquote, but essentially they moved the needle, and they were like, well, 15% of C-sections may be necessary. So I'm like, okay, they moved the needle, still at 15% though. So why are we as a country still at 33%? That means that some of those C-sections are not being done because they're necessary. And now research is coming out, and with Black women, right, if there is an empty bed and a C-section is needed, they are finding that low risk Black women are the ones who are offered the cesareans. And so it makes people skeptical, and that's what we try not to have people skeptical of the healthcare system, because you need to be with a team that you trust. And so I want to just say it again: choose your team before you need them. Watch how people practice. Look at their outcomes. Do they have things on the wall that are celebrating their cesarean rate? That to me is I'm not coming in your office unless I have a placenta that's blocking my vaginal opening. There is no question I'm having a C-section. I want to go to the person who does the C-sections all the time, right? But if my goal is a vaginal birth, I want to go to the midwife or the OB who has a track record of having successful vaginal births. Does it make sense? Right. And then two, having providers who truly believe it. The reason I got my VBAC certification, where we help women have vaginal births after cesareans, is because there were women who were told you had a cesarean, you always have to have a cesarean, right? But we would see that, and sometimes there was no reason for the cesarean. It was just they were told. But we supported a mom, her story is recorded too, who had a vaginal birth after 5 C-sections. But she had to do it at home because no provider would support her. And it was literally 4 days before she delivered that she found the midwife found her. She heard of her story and she was like, "Hey, I want to birth your baby. I want to support this. I've never seen this. I'll do it for you." She came, supported her vaginal birth. That mom is thriving. The baby is thriving. And you just think about it. She would have had another cut. We know what that does to our bodies. Physiologically, you are cutting through the same scar 6 times, and you think about how scars heal. So after the scar heals, it's 80% as strong as the original tissue. And so what is that? What does that look like after 6 times? Right? Like we have to think about that as PTs. That's why we have to advocate, not because we know everything about birth, not because we're trying to be OBGYNs. It is because we know about scar tissue healing. And if we can put someone in a better position by helping them lose weight before the next pregnancy, by keeping their blood pressure down so they're not offered a cesarean. Because for sure, if your blood pressure is elevated, nobody wants you to go through a physiological labor, okay? They're trying to make sure that baby gets out safely and that you stay alive. So now our job is to help mom keep her blood pressure down. We know how to do that. And so I try for people to not think we're trying to become another profession. We are trying to help support those professionals so that they don't have to give an offer to a patient that's not in their best interest at the end of the day. And so I think for me, when I brought on all those different providers, it showed me I can have the knowledge. I know in general, don't eat a lot of salty, fast frozen packaged foods. I know we should sleep 7 to 9 hours at night of sleep. I know I should be getting 7 to 11,000 steps a day. Like I know these general things that are healthy for the general population, but what does my body need in this season, in this moment? And as PTs, we can support that and let people know exactly what that looks like. One thing, we had a mom who was asked to be on bed rest because we found her, we discovered her preeclampsia from home. It was super early. She was taking her blood pressure like normal. But midday, she noticed that like, she just didn't feel right. She was having headaches. She reached out to us, took her blood pressure sky high. She went in and they were like wanting her to have the baby right away, but she wanted to try to keep her baby in because it was only 34 weeks. And so the compromise was that she would admit herself to the hospital. That way they could keep an eye on her, and if she needed anything, she was there. If blood pressure spiked, they needed to intervene. But the doctor was like, "We need you to be here and be on bed rest." So we were like, "Hey, can we compromise? Can we figure out how much movement is too much?" And that way she can still move around, prepare for the vaginal birth that she wants, and then not get bed sores, respiratory issues, like not be completely drained when delivery comes around. Doctor was fine with the compromise. 1,500 steps was the magic number, and she went on to have her vaginal birth 6 weeks later, and no complications. Like we can help if we're invited onto the team.
Dr. Cat, this has been, I'm blown away. I'm blown away. It has been a pleasure. Every time I hear you speak, I learn so much. I'm inspired. I'm ready. I'm fueled up. So thank you, thank you, thank you. I can see you at the NAACP Image Awards because I'm like, this needs to, I don't even know how that would you just need to be everyone needs this. Everyone needs this. It's like, girl, I'm speechless.
I appreciate you. Thank you for having me on. And I love that we both agree we are vessels that God is using. And so the work is awesome, but he's the orchestrator of all of this. And the beautiful thing is every number we have access to, when we put our hand on our neck and we can get our heart rate, people think you need wearables. He lets you get access to these numbers that he's put inside of our bodies so that we can make better decisions, right? And just because it is, we talk about the NABPT, I have to say this. I just think the organization is so incredible. It's when you go to conferences for NABPT, it's not your traditional conference. They're bringing information. You all are bringing information that really is relevant for the time. It's not what is good for physical therapy. It is what is good for us right now. And that means that the speakers who come look different. They're not all physical therapists who are speaking, right? There are people who can pour into our profession and make us better as people. Because if we are not better as people, we can't be the best version of ourselves as physical therapists. And so when I look at Dr. Remy and look at, Dr. DeAndrea and their vision for what the NABPT should be, it shows the power that exists in community. And I believe that that gap that they're filling for us as professionals and as people is the gap that's not being filled yet in maternal health. But that if it would be filled, we wouldn't see the disparities that we see either. So data is important. Community is important because most of the time when a gap needs to be filled, it is by the community. And who does community better than our community? We know how to show up for each other. And so I love that we are equipping ourselves to do it. So thank you for this podcast opportunity for me, but more so for you committing to telling the stories so that other people can know what's possible and they can also know how to make that possible for them.
Thank you, Dr. Cat. Thank you, thank you, thank you. We usually end every episode talking about a test that we've been through that's going to lead to a testimony, or a test that we're going through that's going to lead to a testimony. But I think we did it.
We
I
did it. That's how
think
we started, right? That's how we started. If I didn't say no to the hospital birth, I would have never known what was possible. And when people say, God, how can someone like you go through preeclampsia? And like, didn't that make you feel some kind of way? No. We struggle as believers. We just struggle differently because we know who's in control. That's it.
was a different we started that way. That's it. Thank you, y'all, and thank y'all for listening. This was another episode of Testimony Thursdays. I'm your host, Dr. Jazz. Follow us on Instagram, YouTube, TikTok at Testimony Thursdays and at Dr. Jasmine Blocker. And Dr. Cat, tell the people where they can find you.
At Operation Mist, MIST. Thank you.
All right, now, y'all, we'll see y'all next week. Thank you, and like, comment, and subscribe.